Okay, so welcome everybody today to Brain Tumor Companion Zoom room. Today, this is an educational Zoom on the link between the use of Depo-Provera birth control shot and the link to meningiomas. So there's been a lot of buzz around this recently, particularly since about October of last year, and a lot of questions in our community about what can you do? Where do you go? What kind of information do I need? And so I thought it would be great to bring to everybody some patient stories and kind of what people in our community are planning to do. And of course, to share some information that we know. I have spoken to some lawyers and have done some research myself, and this is very much a marathon, not a sprint. Please know that I've never done Depo-Provera. This is not a case that is affecting me. I'm not going to be part of this mass tort. I'm not being paid by anyone to talk about this. It really is just my patient advocacy effort to reach out to the community and start to educate people on what this is all about. So welcome to the Zoom room, everybody. Is there anyone in particular who would like to go first, or shall I just start by calling names? Don't all jump up at once. All right. Okay. Deidre, you go first.
Hi, I'm Deidre. I am from Denver, Colorado. I have a meningioma that is still in my brain. It's wrapped around my carotid artery. I have other tumors, but not specifically meningiomas. I'm on watch and wait for the rest of my life. I'm 52 years old, and I took Depo-Provera for pretty much my entire adult life, from about 26 to about 2 years ago, or a year and a half ago. So I am involved in the Depo-Provera lawsuit. I did sign up with a law firm to see if I could, figure some of this out, because I found out, I think, just about in October when it came out in a Zoom group, and my jaw dropped. I was like, holy, what? Yikes. Yeah, I had a 4 centimeter meningioma that, when we found it when I was 48, they said it probably was growing for at least 5 to 10 years. So I'm very suspicious that there is a link to the fact that I was on Depo-Provera literally. Let's see. So at least 15, 20 years. I was off it for a slight period when I had my son. But 4 times a year for that many years, that's a lot of shots. I think I've got the marker on that one. Yikes. But yeah, it's frightening. It's bizarre. I would, like I've said, like to just see that there's some information that's given out. It was not given out to me. Definitely there is a calcium deficit that they told me about when I was taking it, like you should up your calcium, that kind of thing, bone density issues, but there was never anything said that there could be something related to a brain tumor. And then when I got a brain tumor, it was like, oh, well, you broke your arm, let's fix it, have a craniotomy, have some radiation, and boop, off you go. Well, no, that's not the case, because I deal with this daily. I deal with anxiety more significantly in the last year, specifically after figuring out like what actually happened to me. And so, yeah, I just want people to know that there's other people out there that,
yeah,
it breaks my heart. It breaks my heart, because I've lost a husband. I've lost friends because of this. And I daily deal with just trying to get through a day without feeling like there's something wrong with me. But there is something wrong with me. And having a group like this to come to, and this support, Angel, that you give, it's incredible. So stay strong.
Yeah, the whole community, right? Stay strong. This is a very blindsided kind of a moment. I think we all have been on this journey with the diagnosis, wondering, how did this happen? and if it happened because of nobody telling us that this high risk result came from these shots, really just very, very sad for our community. And I'm glad you've signed with someone, Deidre, and I'm glad you're gonna fight the long fight. And I hope that, justice comes if there is, this shot to blame.
Yeah.
Thank you
I
for
mean,
that
it's
story.
lifelong bills. My sister,
Mhm.
she's so sweet, but she says, well, where does your money go? And I'm like, well, let's see. $80
Look at how
for
many
my
doctors I have in my
endocrinologist,
phone.
$80 for my neurologist. Let's see all the meds I take, So yeah, I mean, I'm
Yeah.
living paycheck to paycheck and I'm working my ass off trying at least, excuse my
Yes.
language, but it is tough, but being in this group keeps me strong personally. I'm sure it does a lot of other people, but yeah, it's in the words of a passed away cancer person who I followed for a while, I'm not going to be defined by the negative things that have happened to me. Um, at the same time, it's okay, but it's tough.
It's
It's
tough.
tough.
Yeah.
So peace and love to everybody. Love
Yeah.
you all.
Thank you for sharing your story for others to learn from and for being an advocate for yourself to, again, get counsel and to search for your records and to stay
Yep.
present to what's going on. It's very important to do those things. So I'm
Yes.
glad you're doing it.
Yes.
Suzanne, are you available to share a little bit about your story?
I am.
Hi.
So I was diagnosed with my first meningioma in June of 2018. It was 7 centimeters, very large. And I went through my first surgeon, which was, I just feel like everything was just like so quick. I really didn't have the opportunity to kind of like search around at that point in time. So we went with our local one. She went in, she did the craniotomy, said she got everything, tagged it as a grade 1. And then I continued to get my MRIs. And my next MRI that I got, they saw a little whitening and they were like, oh, maybe it's scar tissue. So we're going to keep you on the watch and wait. And that went on for like 5 years, but every single MRI that I kept having, there was new growth, new growth. So I ended up going to Johns Hopkins this time and I had another surgery there. So mine is also around the carotid artery, the optic nerve, and yeah, mine's on my left front. But it's genuinely a struggle. And after my second surgery, Johns Hopkins had requested all the slides from the first hospital. And when they reviewed everything, they were actually like, this was more so like a grade 2, which is why it grew back so fast, not grade 1. And then I did 29 sessions of radiation, which I got through. But now it's just kind of like a whole, I don't know, I feel like it's just a waiting game. Like what's going to happen next?
Mhm. And what was your usage of the Depo-Provera? How long or how often?
So I used it, it would have been right after I graduated, I believe. Um, I would say for a couple years.
So well before you discovered this
Yeah.
condition. Yeah. Yeah.
And again, they thought mine had been growing for quite a
Years.
while.
Yeah. Yeah, it's tough. And do you have a plan of action? Are you going to try to dig up some records and proceed some counsel, or are you going to just maybe let it go?
No, I'm sure I'll push forward. Yeah.
Gotcha. Good. Yeah, you all, again, when you'll be the voices, the voices for everybody for sure. So thank you for being here today, Suzanne. It's nice to see you, and I'm sorry that you had to go through it all a second time, and then to find out later that it was potentially a grade 2 and misdiagnosed, and that really wasn't scar tissue, that it was genuinely
Right.
tumor regrowth. Like,
Yeah, and I was like, had I had radiation done the first time around, would it have
right,
maybe not grown back? So I
right.
don't know. We'll see.
Definitely tough. Thank you for sharing your story, and thanks for being here today.
Thank
Uh,
you.
yeah, absolutely. Colette, do you mind sharing a little bit about you?
I'm Colette Utley from Nashville, Tennessee, and I was on Depo for endometriosis my senior year of high school into college. I would say my brain tumor status now, I had a craniotomy. My brain tumor, although meningiomas we know are benign, mine was life-threatening because it was just a few millimeters from the venous sinus. So I had emergency brain surgery in Boston at Brigham Women's. And today I'm doing well. However, it's life-changing with my diagnosis after brain surgery. Of course, like many of us, I was unable to walk for about 5 months, watch TV or read, and currently I'm back to practice seeing patients. However, I can't drive home because of the brain fatigue that we have, after working all day. Even if it's a rainy day or the light sensitivity, the photosensitivity is real, so I'm unable to drive in the evenings or if it's raining. I would say restaurants are still difficult, noisy rooms or surroundings, and sometimes travel. So a lot of times, although we've all had meningiomas, our life-changing status after a craniotomy and being cleared from our diagnosis is very frightening. So I would say other pertinent things about having a meningioma. Um, is that we didn't know that the Depo-Provera was tied to that. So if we knew that, of course, and our doctor knew that and was aware of this, then we probably wouldn't have had the Depo-Provera. But we're grateful that we do have this knowledge now, and we hope to prevent others from being in the same position. Thank you.
Absolutely. Thank you. And, so glad you were able to get healthy and go back to work. But when you touch on that neuro fatigue, it's so real. We talk about it all the time in the weekly Zoom groups that I host for, peer-to-peer support, that it's just when we just take in information differently now. I think our brain just gets exhausted so much more quickly, and the sensitivities too, like light and noise, is a little bit more heightened, and again, that level of neuro exhaustion that we all get. So sorry that you're in this group with us, but glad that you're here and sharing your story. So thank you, Colette. Christy, how are you?
Hi, I'm good. How are you?
Good.
So I'm Christy. I'm 39, from Teaneck, New Jersey, and in 2021, so 2 years ago, I was getting an MRI, and they pulled me out and said go to the nearest emergency room. I had a 7 centimeter brain tumor, involving my venous sinus, and actually malformed my skull. So they had to remove part of my skull, replaced with titanium mesh, and then it wound up being a grade 2 atypical. So I had 30 rounds of radiation. And I want to say in 2015, I was on Depo-Provera for 1 year, so 4 injections. However, my gynecologist has closed down, so there's no way of getting those records. And the pharmacy that I received the first one from, the owner of it passed away, and they closed down like 2 years ago. I called the board of pharmacy in New Jersey. That's where pharmacy records are supposed to go when they close down. However, they don't have the records because I guess they didn't follow proper procedures when they closed down the pharmacy. So now I have signed with a lawyer, so they're gonna hopefully do the digging because I did a lot. But yeah, we're pretty much at a standstill right now, but
Yeah. Um, yeah, as the information I've learned as well from the lawyers, that if for any reason you can't find records, try not to search so hard. Just reach out to them, let them figure out. They often can reach out to the insurance companies that covered it and get records that way. there's a couple different, layers that I'm sure they can dig deeper than maybe you or I can. So glad that you're putting in an effort to fight it. That's a huge, there's quite a few big tumors in this group. You can't help but to think maybe these hormones were feeding them, but I don't know. I'm not a medical doctor, so don't take my advice, but it is interesting, the connection there. Dusty, hello.
Hello, Dusty from Los Angeles, California. Was on Depo for 30 years. Grade 2 meningioma. So I don't mean to get emotional.
Let it out. This is the place for it. I saw you getting emotional earlier. This is literally the place for it. We are all raw on this journey, and as positive as we try to stay, it's a little heartbreaking at times. So,
And they just found another tumor.
oh, I'm so sorry.
So I'm dealing with that.
So, how long ago was your first surgery, or are you on watch and wait? What is the
4 years.
4 years post craniotomy?
Yeah.
And
And that appointment was supposed to be the kind of you're good to go type of thing. And then that's when I got the new diagnosis.
is it regrowth in the same spot, or is it a new location?
New location.
Did you have radiation post your first surgery?
Yes.
Okay.
And
So
they're
that's,
saying, I'm sorry, you guys.
no, it's okay. No apologies in this room. Again, tears are welcome. Anger is welcome. Celebrating your wins is welcome. Everything is welcome in this group. This is a tough journey.
And this tumor they're saying is from the radiation.
Yes, that was going to be my next question, was do they believe that it's in the path of the radiation? Because
Right.
radiation has a tendency to split the cells, and then they kind of bounce and lay dormant sometimes for a while. And
Yeah.
it appears to be around that like 4 to 10 year mark is when maybe they might resurface. And you're right now at the 4 year mark, which makes sense.
Right.
And
And it's inoperable because it's so deep.
so it's in the brain.
Yeah.
Are you having side effects from it, or you thought maybe you were clear and they just happened to find it?
Right. Yeah. Because it was the appointments, MRIs were like every 6 months. So he goes, okay, this next one we'll let you know. We'll bump it to a year.
Right.
And that's when they told me.
And
So
the size, is it's very tiny, or does it look like it's maybe growing pretty rapidly? Because you
I
figure
guess
it's in a year window.
they found it a year ago and I didn't know. And so from February to August, it had grown. So that's when they told me, like, hey, we found something else now.
Wow.
So it's kind of, they said they can't operate. So now I just have to wait for side effects to see how it's going to affect me.
And based on the amount of growth from when they found it and didn't tell you, and what they found of recently, would they consider that pretty rapid growth? Like, are they concerned at all that it might be a cancerous tumor, or do they feel it's benign, or they don't know yet?
They don't know yet. My neurosurgeon is more positive than my oncologist.
Okay.
So they said we'll just have to treat side effects versus treating the tumor itself.
And have you signed up with counsel? Have you gotten in touch with anyone on your
Yes,
behalf? Okay, good.
Yeah, signed up last
Yeah,
year.
I mean, 30 years is a long time. And this is what, in speaking with the lawyer, this is what people need to understand, is this condition isn't a one and done. You don't put a cast on your arm, take it off, go back on the basketball court and everything's good. Like, this is, for many people, a lot of doctors, a lot of treatments, a lot of MRIs, a lot of medical expenses, a lot of deficits, visual, seizures, walking, talking, swallowing, hearing. There's a lot of care that might need to come post. And it's a very terrifying journey to be on, because we always have to get MRIs for the rest of our lives. They
Right.
don't, they say you're fine, but if you're fine, you don't have to go back to the doctor every year for the same condition, right? You can move through it. So, or 6 months or whatever your timeline is.
And
Dusty, I'm really sorry.
the sad thing is they're still prescribing this medication. And a
Mhm.
lot of these
Every day.
doctors don't even know. Like, I've gone to my primary care, I've switched over to a new one, and they're like, oh, we didn't know that. We haven't heard that. I'm going to look into that. And that's what's scary, is that they're continuing to prescribe this medication when there could be a possible link. I mean, go ahead and still prescribe it, but put that warning out there to people to let them make their own decision. Like, hey, okay, I'm going to take that path and subject myself to a possible brain tumor.
Mm-hmm. Yeah, it is shocking to me how many people don't know about this. And then it was hard in the beginning when it started coming out, because everyone's like, is this a scam? Is it, lawyers just trying to recruit people's
Right.
information and steal identities? And so obviously I started digging really fast. Like, is this real? Because this is crazy. I mean, I can't tell you how many people I know has taken this shot. So yeah, it's really unfortunate, but I'm glad that you have signed up with somebody. And obviously, if ever I can be of any support to you, you do not ever be shy to reach out, join group, all of the things. And I thank you
Thank
for
you.
sharing your story. And I'm really sorry about your second diagnosis. The reoccurrence in a different location in the radiation path is that's tough. It's not what anyone wants to hear. Jen Austen, how are you? Share a little bit about your story with us.
Yeah, thanks. I'm so sorry, Dusty, for your second diagnosis. My heart's with you, hon. I was diagnosed in April 2018. I'm actually at the ER, and they diagnosed me with two meningiomas right off the bat. So I have one on my cerebellum that was removed in June 2023, and then one still in my left orbit that I'm still on watch and wait for. So thanks for hosting the Depo-Provera session, Angel. It's good to have the information, but it makes me so angry, and things I didn't know when I got those shots back in 99, 2000-ish. Within a year of my brain tumor diagnosis, I also broke both of my legs. So today, finding out that there's a link with osteoporosis with the shots also makes me angry. And they knew that. I never heard that from my doctor, to watch out for things or that there could be osteoporosis issues, along with brain tumor issues, and that they know that now. And I just still saw a poster up for Depo-Provera at my OBGYN's office just in February. And what are you doing? You don't put somebody else in this position and make them go through the things we've gone through. It's not just getting a shot and everything's fine and send you home. This can really alter people's lives. I'm pretty fortunate in my scenario. Once they took my tumor off my cerebellum, my walking greatly improved. My falls, I was falling often and sometimes with serious consequences, and those kind of resolved a bit. But none of us should have to be going through any of this, so.
Yeah.
But thanks for sharing the information, and I hope that everybody else takes a close look at the information and thinks about fighting back,
Mhm.
for
Yeah,
all the things that.
everyone who can be eligible for, pursuing this, I think should. It's worth it just to get our voices heard, right? Again, I never took Depo-Provera, but if I did, I would be first in line to be like, sign me up. This is a thing that needs to be brought to everyone's attention. We need to fight for our rights here, because not telling us, not good. If they knew that it had a 10 times risk of a meningioma or 5 times, whatever more greater risk, like that should have been mentioned for sure. Even the bone density, like you said, I didn't know that it decreased bone density. And so often people in my community have taken these shots are like, yeah, and then I fell after my surgery and I broke my arm. And it's just like, all these links are just not good. Anyhow, thank you for being here today, Jen, and sharing your story. To my next Jen Cons, if introduce yourself and share a little bit about your.
Yes. Hi, Angel. How are you?
Good. Welcome.
Thank you. I'm Jen. I live in Phoenix, Arizona. I'm 37, and I was diagnosed with a grade 2 meningioma in June of 2022. I had 3 craniotomies due to multiple complications, 2 rounds of radiation, and prior to my diagnosis, I had severe deficits on the right side of my body. I had basically no use of my right hand or my right arm, and I could barely get my foot off the ground to walk. We initially thought it was a spinal issue, so I'd seen a chiropractor, and then noticed muscle atrophy on the right side of the body and asked my chiropractor about that. And she said, you should really get in with a neurologist, and they found the tumor. So I still have some residual disease left on my sinus that they were not able to remove safely. Overall, I'm doing pretty darn good for where I started. I have a lot of fatigue. I'm constantly tired from the moment I wake up to the moment I go to bed. I can never get enough sleep. I do get tremors on the right side of my body with activity. I work out a lot. I like to hike, and my leg and my arm will just start tremoring. I'm not signed with a law firm, but I do intend to do that.
Excellent.
And I was on Depo for 4 years. I don't remember if I mentioned that.
Yeah. Yeah, I would definitely, sign up with somebody and get your records together and your story on paper. Again, it's going to be a marathon, so it might be 5-10 years from now before you know if you're eligible for anything, but doesn't hurt to put your name in the hat and be a voice for this situation. Thank you for being here today. Thank you for being part of our community. It was nice to see you.
Thank you.
Trish, you want to share a little bit of your story and your Depo-Provera link?
Hi there. Thank you very much, Angel, for hosting this, and thank you for all your service. To everyone who has preceded me, Deirdre, Suzanne, Colette, Christy, Dusty, Jen A, Jen C, thank you for your stories and your inspiration, because it is a marathon, it's not a sprint, and we have all joined a club we never wanted to join. And for me in particular, it's my at least second club I haven't wanted to join. I was on Depro between 4 and 5 years. It's a little fuzzy because I've lived overseas for 15 years and I need to acquire the records that were previously situated on this continent. But I had an intradural extramedullary C3 to C5 meningioma, which was growing, pressing on my spinal cord inside of the column, taking up a third of the space. So first thing I noticed, I couldn't hold a coffee cup, and then I had a toe drag. And then when I tripped and fell and amputated the index finger, it's back on, of my right hand because I grabbed the door jamb as I was falling and the door closed, things started to fall into place. Like, this isn't normal. So I've previously been a hiker, a rower, a dragon boater, you name it, pretty active. So having something pretty debilitating happening to me was a shock. But I went to 18 doctors and then finally got sent to radiology, where they did a bunch of MRIs. And then the chief of radiology came out and said, we need to send you for an x-ray to confirm the findings. When you hear that, it's like a bad scene in Grey's Anatomy. You just think, you need an x-ray to confirm the findings, and you're doing an MRI of my brain? It's just like, it doesn't make sense. So
just go blank. It's like after that, everything just goes blank.
And that was on a Saturday morning because, worked during the week, and I brought my daughter to the hospital with me, and she sat patiently as a tiny human in the room, the doctor's office, and they put on cartoons for her. But anyway, the preceding next few months were pretty traumatic. I vetted 4 neurosurgeons. None of them were successful in understanding what was going on because I was in a foreign country. And I even went to a cyberknife specialist, and they said, we won't do radiation on it. And I said, okay. And then I politely moved my medical care, which was a thorough uphill new club I didn't want to join battle. And I was bounced up to the chief of neurosurgery at UCSF. So I was lucky to get that kind of care here in the United States. But this has been a fracturing not only of bone and brain matter, but also of my heart and of my family. So this is truly the most grueling, eviscerating experience of my life. Mm-hmm. And to know that I did this for reasons to eventually meet my lovely children who I love and adore, but just to kind of put that on pause. And, you know, ever since I went off of it, I've never been on any other birth control. Mm-hmm. So I'm very lucky, I'm very blessed, but people say, oh, it's just a benign brain tumor. I'm like, okay.
Nothing makes us cringe more. Hearing benign is fine. It is not fine. Still very much a whirlwind.
Yeah. So physical therapy, occupational therapy, listening therapy, swallow therapy, you name it, wearing a gait belt, relearning how to walk, not being able to drive, still having, you know, to worry, you know, it's a big deal. So I currently have pins and plates and rods in where they resected the tumor at the base of my brain. The incision's about yay long. And on my most recent checkup, they said that I have a fractured C5, which has collapsed on my C6. So it's all resting on my C7. So I'm walking around with a broken neck. It's a little bit of an embellishment because a fracture is, you know,
right.
A fracture. But
yeah,
you can't, like you were saying, you can't put your arm in a sling. I can't rest my C5. I needed to breathe. I needed to swallow. I needed to talk. I need to turn. If I'm looking for traffic, I still need to move from my waist. And somebody called me R2D2, and I was like, great, cool, because that's really funny. I mean, I get it. It is amusing, but yeah, it's been an incredible journey.
And patient, it's very painful.
I'm really grateful that you're here. So thank you for hosting all of this.
Absolutely. Thank you for sharing your story. Yeah, it's just a tough journey for all the reasons that you expressed. For, you know, it's never even just us, it's our family members, it's our friendships, it's our work environment. It just affects so many different things. Christy, I know you wanted to mention a little something.
So September of this 2024 that just passed, I was having like knee pain, and I was like, with my whole brain tumor experience, I know you don't wait to go to the doctor, you just go. So I went, and I was like, I need to get an MRI of my knees. And I was just expecting, I don't know, nothing crazy. And my orthopedist said that I have osteonecrosis in my right knee, because we were only doing my right knee. Then I went to a different orthopedist, and I said, well, my left knee hurts too. They did an MRI on my left knee, and I also have osteonecrosis in that knee. So now I'm on a medication called alendronate that I take once a week, and I have to be on it for 6 months. With the side effects of that being like osteonecrosis of your jaw and like a slew of other things. But I think it is also linked in some way to getting the Depo-Provera shot, because I know it has to do with like bone density and stuff. And if you look it up, I think one of the side effects of it is osteonecrosis. So eventually, I'm hoping this medication works, but down the road, I might need double knee replacements because my knees are basically dead.
Yeah.
To say the least. That's the other fun thing about getting this shot.
Anyone else in the group by raise of hands have any other like like fractured bones or, injuries that maybe you had that seemed, I know, yeah, Jen Austen, you had mentioned that you did early on. Definitely something to pay attention to. Like, did you feel maybe your bones got more fragile? So some of the things we do know, thank you everybody for sharing your stories. I think I got around to everyone. And again, the emotions are very real and raw, and I appreciate you expressing those too, because this journey is long and it's hard and affects you and a lot of other people. And it's a very confusing one to be on because there's very little information, there's very little support, and not a lot of guidance. And if you Google about it, you're probably already dead. So stay away from Google. It's not a good doctor. It can really take you down the rabbit hole. It is great for information and legit research, but sometimes it can really scare you too. So try not to scare yourselves too much. But in speaking with some lawyers, what we do know about this, and from some of you who have signed, this is a minimum 4 to 5 year litigation process. It's going to be a very long process, and it is not a class action lawsuit. It is going to be a mass tort. And basically, a lot of law firms across the country will be collecting data from eligible patients, and they will be filing these and forwarding them for review. And you can sign up, with people locally if you want to inquire with some that I know our community is using. I'm happy to pass that information along to you, but this is going to be a federal court appointed situation. And all of the cases I have heard are going to be passed to Judge Casey Rogers in Florida, who's been assigned to this case. So this is what I know. It may change. And again, I'm learning too, and I'm not a Depo-Provera patient, so I'm just trying to collect data for you guys. Some people are requiring patients to have at least 2 shots. Others are saying 4, but basically they're looking at 4 because that means you took Depo-Provera for at least 1 year in your lifetime. And so that's kind of what they're taking as a baseline for, are you eligible or not? We know a lot of these cases go back as far as the 90s, that not everyone has records, right? That your doctors might not even exist anymore. They may have passed away. They may have closed shop because they're retired, whatever. You could get records through your insurance company you had at the time. Maybe if you dig through your credit card receipts, if you talk to the pharmacy in which maybe prescribed it. There's a couple different ways you can dig, but really you want the lawyers to do the digging for you because they're the people who have access to this. So it's a matter of just knowing what timelines you had taken it, what your diagnosis is, and being able to share all those details with a counsel so that they can start this fight for you. It's really unfortunate. This shot is being used every day, and a lot of people have no clue about this link. And the brain tumor diagnosis rate keeps going up and up year over year. And so I think there's a lot more people walking around with this condition that have no idea. And they say they have headaches and get dizzy, and they get sent to physical therapy, or they get prescribed a medication for pain. And no one's ever actually doing an MRI and looking at their brain to see what the heck is going on. So that's part of what needs to change as well. I know I would love nothing more for me if I had been given an MRI at the age of 35 to just say, hey, this is your baseline, much like a mammogram or a colonoscopy. Why are we not looking at our brains? You'll prescribe me psych meds, and you'll prescribe me headache meds, and you'll send me to physical therapy for things that might all be related to a 7-centimeter tumor pressing on an important part of my brain. And maybe that needs to come out and be looked at first. So there's still a lot of work to do around brain tumors, and a lot of education that needs to happen, and a lot of awareness that we can be spreading to others so that when they are in situations that we were in, maybe they think to advocate for themselves and tell their doctors, hey, I want an MRI, and get the MRI with contrast, because that's how these tumors pop and show up. An MRI without contrast, something can get missed, but with contrast, it's very likely to be found. So does anyone have any additional comments or thoughts or anything that they want to share about this case, about what I just talked about your condition? Anything goes. Again, this is for our community and for each other. So if you have something you want to share, feel free to do so. Just raise your hand. Okay. I thought maybe I'd end with one of the things I do when new people join my Zoom groups, so that others can get an idea of what we all struggle with. Really, by raise of hands, go through like a list of questions to share, where you're at with your condition. Because again, I think a lot of people don't realize all the trickling effects afterwards once this starts. So first and foremost, who in the room is post a surgery, whether it was nasal craniotomy, but post a brain tumor surgery? Okay. Who is also on watch and wait, has lingering tumor behind, has a different tumor there on watch and wait, was re-diagnosed, all of the above. Okay. Who has done radiation in this room? Okay. And who has had reoccurrence post radiation? Dusty, I think you had reoccurrence post radiation, right? Yeah. Who here is struggling regularly? Actually, is every day like really fighting kind of the post deficits of this condition? You're just struggling with stuff. All right. Who suffers from pain, whether it's brain tumor related pain or any other pain, but it's just something you have to manage in life? And how about depression? We're just going to be honest and go there. Who struggles with that as well? Okay. How about anxiety, whether it's related to the condition or not, but some level of anxiety? How about PTSD? I know for me, it's medical PTSD because this has kind of rocked my world. Okay. Sleep issues. Who struggles with sleep on the regular? Sleeping too much, sleeping too little. Okay. How about sadness? Who literally could just cry at the drop of a hat once in a while because they think, how the hell did this happen to me? Who's angry? Anyone who read my newsletter this month saw my whole March Madness thing. Who's angry that I have to be in this room right now? I'm in this club that nobody gets in line for. It's okay to be angry. Nobody wants this diagnosis. Who has fatigue, whether it's regular fatigue or neuro fatigue, but who is like blown away by the amount of fatigue that comes with this condition? And who has memory loss? Who struggles to find words, forgets why they walk in rooms, is beginning to wonder, is this going to get any better? How many in the room are on 4 or more medications? Seizure meds, thyroid meds, whatever kind of meds, pain meds. Okay. Who actually likes their care team? Who believes that at the end of the day, I'm in a shitty situation, but I really do have a good care team? Like I trust my doctors. Okay, well, that's a plus. Who has lost friends or loved ones over this condition? Realizes that some people just don't get it. Okay. Who has more doctors in their phone than friends? Who is sick of looking at the DR section of their cell phone contact list? I mean, the list is long in mine. Every time I get to the D's, I'm like, Jesus, this is crazy. Who can still drive? Who still can drive? I can, yes. Okay, that's good to know. And who actually genuinely feels alone? Like nobody gets this. This is my cross to bear, right? Nobody quite understands it. It really is for me to figure out. I'm kind of alone in this journey because when I talk to people and they're just like, okay, but it's benign. You look good. I'm so happy for you. But like nobody really gets it, right? It's hard to understand. And we wouldn't want them to. Nobody wants their friends, family, or loved ones to be on this journey. I mean, I wouldn't wish this on anybody. So anyhow, thank you all for going along with that. It's nice, I think, for the community to see kind of what this all entails and to see themselves in us because they are not alone. We do have each other. And it is tough. And whenever you need a place to come dump it all in, you come here. Okay. Because this is not happy hour conversation. This isn't dinner date conversation. This isn't birthday party conversation. Friends and family don't get it. They don't know how to respond to us. They think it's weird. They're just glad we're okay. And for all the stuff that we feel and we need a place to go, this is always a safe space. So Trish, you have a question or a comment?
Just a funny comment, or I think it's funny. Add to the list how many of you heard, but you look fine.
Oh, I don't have enough toes or fingers for how often I hear that. You look so great. I can't believe you've had brain surgery.
Wonderful. You're glowing.
Yeah. Yeah.
That's because I don't have temperature regulation.
Yeah. So true. So true. All right. Well, if there's nothing left to be said, I just want to thank you all for being here today. Thank you for allowing this to be recorded and for sharing your knowledge on this journey. To anyone listening, if you are interested in getting more information about a contact for counsel, feel free to reach out to me and I'll be happy to share some of my resources with you. This again is going to be a long time coming, and we'll just have to watch and wait with the Depo-Provera case, just like everything else on this journey. So take care of yourselves, be good to each other, and I hope to see you on a Zoom in the future. Thanks, everybody. Take care, be well, and catch you next time. Bye.